Through collaboration with GS1Net, the Packaging Accessibility Rating has become government and a retail standard for estimating the percentage of consumers who can safely open packaging.
Good morning, Enid. How are you? This is for your morning tea.
When a patient can easily open their food packaging, they're more likely to enjoy the meal and they're also receiving the nutrients that they require.
And if you're in a hospital, you are dependent on good food to help you improve. Well, if you can't open the food, you have to ask for help. Otherwise, you don't eat. If it's not easy to open, well, it doesn't make you feel very happy about it.
Being able to eat what they want is one part of the patient's stay that they can control. When you take that away from them, you take away their dignity.
Very often there is something that, it just doesn't apply properly. So sometimes things are hard to open and you get a bit impatient and you make it even worse for yourself.
The Packaging Accessibility Rating can be accessed by procurement managers through New South Wales, the Victorian Government, or organisations like the IHHC. It's also available through GS1, both nationally and internationally.
So the Packaging Accessibility Rating is mandatory in over half of public hospitals in Australia, and this has been through an alliance between HealthShare New South Wales and Health Purchasing Victoria, and is increasingly becoming mandatory in the other states and territories.
It's only through the IHHC that private hospitals and aged care facilities can gain access to the ratings nationally.
The Packaging Accessibility Rating, it's based on an accessibility benchmarking scale that has a rating from a +8 to a -8. +8 being the easiest to open, -8 being the most difficult to open.
Very easy, actually. All I had to do was take it where it's shaped to there and I tore it.
One of the great things about the ratings is that it's significantly growing sales for Australian manufacturers because now at a procurement level, innovation is recognised.
The way that we use it in health is a procurement tool in that where we might have competing brands and where all else is equal, the product or the brand with the highest rating would be the one that we would select.
Good morning, Sasha.
Oh, good morning. When it's easy to open, it makes it easier to eat it, then it's enjoyable more.
At the end of the day, it is a win-win for everybody involved, especially for our people that we're looking after. They've actually got food that they can consume themselves.
The rating is a win for both healthcare and industry because the patients get to eat what they want and the companies get to sell more products.
And we would like to call upon our colleagues and on industry to work with us to make packaging of food easier to open.
Delightful. Well, very nice. I'm waiting to start eating.